Welcome to the Special Call Committee of the Whole meeting. I call it to order for December 1st, 3:30. The time is 3:35 p.m. Thank everyone. Thank you, counselors. Thank you, staff, everyone for attending. We do have an agenda that has been published, and we do have that in front of us. So we'll call the meeting to order. I do have a quorum present. And the first item is approval of the minutes. So I'd like to entertain a motion for approval of the minutes from the Tuesday, August 17th, 2021 Committee of the Whole.
I move for approval.
Second.
Any questions? All those in favor, please say aye.
Aye.
All right, thank you. Those minutes are approved. I would like to ask councilors if you would entertain and allow me to change the order of the agenda. And I'd like to have first item up is our ICE interlocal agreement. So, chiefs, if you will let us know who will be presenting that information to us. Thank you.
Yes, good afternoon, Council. Once again, thank you for having this committee of the whole. It's long overdue. We really appreciate the time. So before you, the interlocal agreement that was before the Council, I think maybe a month or so ago, and it was referred to committee. So we have Madam City Attorney that will introduce the lawyer that wrote the legislation or the ordinance that can speak to it. And if you have any questions from then, we can entertain any other questions.
Right, and let me ask, do we have any copies of the original items? I know that
we can get you some
there's a question.
We can get you some.
We'd like to have those. Thank you. All right, so if those speakers would please come up.
Please come forward. Attorney Roberts.
And let me just remind you, we still are under some COVID-19 guidelines, and so I do ask you if you can, we'd like to ensure that we're spacing correctly. We're still asking for 6 feet apart, and try to ensure that spacing. And we do have a rule in City Hall that we wear our face masks, so be sure they properly cover you. So go ahead, except when you're speaking. Thank you.
All right. Good afternoon. Is this on?
Yes.
All right, good. I'm Tracy Roberts, Assistant City Attorney. You have before you an ordinance and an agreement. This is an interlocal cooperation agreement, and an ordinance is required.
Oh, we're getting that in front of us. We don't have it in front of us. We didn't make copies. I apologize, but
okay.
You can go ahead and continue.
All right. They were submitted, but this is an agreement between the city and ICE's Homeland Security Investigations Division. This agreement will designate certain BPD officers from the city's Vice and Narcotics Division as task force officers. Those officers will be designated as customs officers, and it's important to note, not immigration officers, but custom officers authorized to assist in enforcing certain federal criminal offenses that threaten national security. These include human rights violations, human trafficking, and smuggling. And the assigned Vice Narcotics officers will not be responsible for enforcing administrative or civil violations of immigration law, including civil detention or deportation. And that's the gist of the ordinance and the agreement.
No, during our council meeting, we did have some questions regarding the wording and any changes that were going to be made to that ordinance. So I know you could sort of explain or outline what those changes are, correct?
Okay. You're asking specifically about the changes from the ordinance that you previously
Yes.
saw? Okay. Let me get that in front of me. Let's see, that document is going to be here. All right. Specifically, we added some of the clauses in the recital. Whereas HSI, which is Homeland Security Investigations, whereas HSI is the principal investigative arm of the U.S. Department of Homeland Security with broad law enforcement authority to investigate all federal crime and with primary jurisdiction over 400 federal crimes. And whereas HSI's primary mission is to investigate transnational criminal organizations and other networks whose actions threaten to exploit public safety and national security. And whereas BPD employees assigned to HSI as task force officers will not, by virtue of cooperative agreement, memorandum, or understanding and this ordinance, participate in any immigration enforcement activities, and the authorities granted to sworn task force officers do not grant them the authority to act as immigration officers as defined under 8 U.S.C. 1101 parentheses A parentheses 18. And whereas BPD employees assigned to HSI as task force officers will only investigate criminal activity as defined under federal and Alabama state law as they relate to the mission of Homeland Security investigations, to include such crimes as human trafficking, child exploitation, and other forms of human exploitation, drug trafficking, financial crimes such as money laundering, firearms offenses and violent crime, illicit trade, and other such offenses that directly impact the public safety and well-being. Those are the additions.
All right, thank you. We don't have our pads in front of us. Counselors, are you ready to ask any questions? I know we don't have the document in front of us. Are we ready to entertain any?
They're making copies right now, but we can still entertain any questions that you might have heard from Attorney Roberts.
Any questions?
Madam President,
Yes, Ms. Abbott.
it's like if you could enumerate that list again of what is included. Can you not hear me? I'm sorry. Can you just go through that list of the things that our people will be doing one more time?
Okay.
Human trafficking, child
the last part,
exploitation,
yes.
you know, that list.
So the last part, whereas BPD employees assigned to HSI as task force officers will only investigate criminal activity as defined under federal and state and Alabama state law as they relate to the mission of HSI, to include such crimes as human trafficking, child exploitation, and other forms of human exploitation, drug trafficking, financial crimes such as money laundering, firearms offenses and violent crime, illicit trade, and other such offenses that directly impact the public safety and well-being. That's the list of offenses that they would have jurisdiction to enforce, but as I understand it, they primarily would be focusing on human trafficking and human smuggling.
Thank you.
Thank you, Attorney Roberts. Any other questions or comments from the council? I'm good? All right. Thank you, Mr. Roberts. And Ms. Tate? And you want Attorney Roberts?
Attorney Roberts. And so I did hear everything you said, that the officers would be approved of doing so. This, under any circumstances, with this new ordinance, does not target the immigrant community.
So, Attorney Roberts, if you can hear, I got you, Councilor Tate.
Can you hear me? Okay.
So can you read that whereas above that, the one that you just read about what the officers are supposed to do that's not dealing with immigration? It's right above the whereas that you just read.
Right
to
above
council.
that?
Yes, sir.
Okay, yes, I understand that. Okay. Whereas BPD employees assigned to HSI as task force officers will not, by virtue of the cooperative agreement, memorandum of understanding, and this ordinance, participate in any immigration enforcement activities, and the authorities granted to sworn task force officers do not grant them the authority to act as immigration officers as defined under 8 U.S.C. 1101 parentheses A parentheses 18. Is that what
Okay.
you're?
I just want to make sure that we're clear, that we're moving in the right direction.
Understand.
Okay.
This box makes it hard to hear. I'm
Thank
sorry.
you.
Thank you, Ms. Tate. You don't have any other questions? So, councilors, what is your wish? Are we ready to move this item forward to our next agenda?
Madam President, actually, at this time, I'd like to call the police chief up here and ask him what type of cases that this task force has investigated in its tenure at BPD.
Thank you. We'll be able to have the chief to come
Yes.
up. Thank
Yes.
you.
Police chief.
Thank you.
Chief, I know that a lot of the cases that you guys investigate are confidential in nature, but I know that there are some generic success stories that this task force has been able to achieve. Most recently, the recovery of the 3-year-old kidnapped victim from a few weeks ago. Just for this council's knowledge, is there any information you can share in a very generic sense of what this task force with the BPD officers has been able to investigate or achieve?
So generically, and thank you for asking me, but generically our officers are primarily focused on violent offenses, human trafficking, recovery of children in the instance that you referred to, but primarily about drug offenses and gun-related crimes within the city. Keep in mind that we have already had agreements previously. We've have agreements with most of our federal task force and most of our federal agencies at this time.
Thank you, Chief.
All right.
Thank you, Madam President.
Thank you. Any other additional questions? All right, thank you, councilors. Could we entertain a motion then? We can move this item to our next council agenda. Do I have a second?
Second.
Any questions? All those in favor, please say aye.
Aye.
Any opposed? That item moves to the next council agenda. Next item is ARP, American Rescue Plan. Who we have presenting that for us?
Make sure everybody here first. Okay. Oh, thank you. So thank you, Councilor. So we have a team that, if they can step forward, we have Miss Amelia Muller, Coriate Hauser. They may be in the hallway. Come on, guys.
Thank you.
And if Mr. Datcher is outside. So, of course, the council, we have always been in conversations with this council about the ARP funding spending, and we are ready to present to this council the remaining amount out of the first tranche. As you know, that the first tranche, the 2 allocations that were already approved by this council was the premium pay for all employees and part-time employees, and for the BRT project. So I'll bring up Ms. Amelia Muller that will go through the items that you have before you for the remaining amount, and we will answer any questions that you may have.
Thank you. Have we already got that? All right, Ms. Mueller, go ahead. Thank you.
Hi, good afternoon, councilors. My name is Amelia Muller, and I serve in the mayor's office. It's good to see you this afternoon. So we're here to talk about the remaining funds out of Tranche 1 of the American Rescue Plan. So just to reorient us again, the city's receiving a total of about $141 million total from the State and Local Fiscal Recovery Fund from the U.S. Department of Treasury. We received our first tranche in May of 2021 and have made 2 allocations from that so far, one for employee premium pay and one for the bus rapid transit project. So that brings us to a remainder of about $35 million in that first 70 that we've received so far from the U.S. Department of Treasury. And the items before you are really for the top line allocations of those remaining funds. Any of the projects that we would be implementing to utilize those funds will come back before council on a project by project basis. So today, the line items that you see before you are really more those top line allocations. So I'll take them one at a time, and as we have questions, can call up colleagues who may have follow-up. So the first is related to supporting critical workers. So while we did do a one-time employee premium payment back in June for city staff. This is really specific to those city staff who have not been able to take their vacation due to the limitations of the pandemic in the calendar year 2020. So we're, this all sort of follows along on that basis. So we're really speaking here to sworn police, 24-hour sworn fire, and field personnel for the Department of Public Works. This will be a vacation buyout for time that they've been unable to use. We did allow them to roll over that time, but we're basically now at a point where we're choosing to buy them out for that time and kind of wipe the slate clean, if you will, on that rollover. The reason you see a range before you here is simply because it is a snapshot in time. So when we bring that back to you in resolution form, it will be a more detailed figure, likely on the slightly higher end of this spectrum related to the vacation buyout.
We'll hold does the council have any questions about that particular item?
Thank you, councilors. Anyone? We see that we have a range that will probably be presented to us from $650,000 to $900,000, not to just restate what you've already said. And we know that we did do some funding, about $17 million, to support staff, the employee premium pay. So this is to provide support for those staff who worked over hours and really worked beyond, correct, as far as during COVID-19.
Yes, they didn't have the opportunity to take their vacation time, and at the end of the year, they had the choice of losing it all, but we managed to put a system in place to allow them to roll it over, and they still, almost to this day, still cannot take that vacation time due to the pandemic. And so this is our best effort to show that we want to give back to the employees and make sure that, show a good faith effort of giving them their money back for their vacation that they could not use.
Thank you. Councilors, do you have any questions about this particular section? Ms. Clark?
I apologize for being a little distracted. Did you note the departments or functions that would be eligible, or you did?
I did. I'm happy to repeat them.
Okay.
So it will be limited to really public safety related staff and sort of other critical workers. So that's 24-hour sworn fire department, sworn police officers, and field personnel for Department of Public Works. Only those departments.
Okay, so field personnel for Department of Public Works. I know some of the park maintenance is divided between Public Works and the Park Board.
So most of the maintenance of the parks are supposed to be under the Park Board, but we have, our DPW department has handled that up until a couple months ago when we put an allocation out for them to have more equipment to cut the parks. With Public Works during this time that's before you,
so it was all
done by Public Works.
It was all concentrated in that function during the period you're going to cover. Okay.
Yes,
fair enough. Thank you.
Thank you. Any other questions regarding this particular section? All right, thank you. Go ahead.
Thank you. So the next item you'll see before you is community-based public safety with a top-line allocation of $3 million. Of those, we're proposing the largest allocation to a program with the Jefferson County Health Department related to hospital-linked violence intervention. And we have Dr. Mark Wilson and some members of his team from the Health Department who will speak to that line item. And I believe we have some visuals as well for you.
And then we'll have Mr. Kelvin Dasher, who is our senior advisor for the special project, will tee up the county health department for their presentation. So go ahead, Mr. Dasher.
Good afternoon, Council.
Good
as you guys
afternoon.
have gotten to know, unfortunately, for bad circumstances, but it's a great outcome, one of our great leaders here in the community, Dr. Mark Wilson, the health officer for the city, the CEO of the county, the CEO of the Jefferson County Department of Health. He has been a phenomenal leader, sometimes at great personal risk through the pandemic. And I just wanted to take that point of personal privilege because I know him very well and consider him a friend. He has done dynamic work for our community in efforts to keep us safe and to drive this community forward through a solution and a better outcome for the public health crisis that is the pandemic. But the mayor, with your support, also declared gun violence as a public health crisis here in the city prior to the pandemic. Dr. Wilson, prior to the pandemic itself and throughout, has stayed focused on solutions, and he has a really innovative partnership that we like to propose to the council today. Dr. Wilson, and he has a few team members that he will be introducing.
Thank you, Mr. Datcher, for your kind words. You all receive a copy of this written proposal? Because I have extra copies if you need it.
I don't think we've got
There's
it.
about 9 copies here, if you need those. Jefferson County Department of Health has made a commitment to provide all the funding necessary to establish a hospital-linked violence intervention program in Birmingham and Jefferson County. I'm here today to ask the city for additional funding to expand this program after its first year of implementation. I'm joined here today by Karia Dye, an epidemiological analyst at the Health Department who's been very involved in our stakeholder engagement and planning for this program. Just give you a brief introduction to the program. Hospital-linked violence intervention programs, or HVIPs, are evidence-based violence intervention programs and prevention programs aimed at reducing the revolving door of violent injury, especially gun violence. The HVIP engages surviving victims of gun violence while they're still recovering in the hospital. This is a setting and a time that offers a unique opportunity to intervene in the victim's life, reducing the chances of them becoming a repeat victim of violence and to help prevent retaliation. In other words, breaking the cycle of violence. UAB Hospital Trauma Service is very anxious to be a partner in this program. While still in the hospital, gunshot survivors will be given the opportunity to receive case management services and be linked to a trained violence intervention specialist in person. This is typically a paraprofessional from the community who provides trauma-informed crisis intervention, longer-term individualized case management based on needs, linkages to community-based services, mentoring, home and community visits, follow-up assistance designed to promote health, including mental and physical recovery from trauma, and treatment for substance use disorder if needed. The case management services and hiring, training, and oversight of the violence intervention specialists will be provided by a community organization which will be identified via a request for proposals, which we've already drafted, and a granting process. The goals of the HVIP are the following. 1, reduce subsequent acts of violence, improve physical and mental health outcomes, enhance educational attainment, and improve employability and employment status. Further objectives for each of these goals are listed in the written proposal you have before you. They're on page 7 if you want those details. I'll give you just a little bit of background on how we got to this point so you'll know this isn't something we just dreamed up overnight. A lot of careful thought, stakeholder engagement, consensus building, and planning has brought us to this point. One objective in our Jefferson County Department of Health strategic plan, which began in 2017, was to establish a strategy to address the problem of violence. Early on, we began gathering some information on various types of programs and getting input from some key informants, including Brandon Johnson with the Birmingham Office of Peace and Policy. Then, after I was invited to be part of the Birmingham Safe Neighborhoods Task Force in 2018, JCDH offered to help by funding the hiring of a local strategic planning consultant to facilitate broad community input, which actually helped inform the development of the City of Birmingham's Peace Strategy, which was published in 2019. You may recognize this document. And as Kelvin already mentioned, we did join several council members and the mayor in February of 2019, together declaring that gun violence in the City of Birmingham is a public health crisis. Our health department also facilitated a Jefferson County Community Health Assessment, which we do every 5 years, and then the development of the 2020-2024 Community Health Improvement Plan for Jefferson County. That plan, that process and that plan identified controlling gun violence and improving community safety as the #1 strategic issue for improving health in the county. To give you a sense for the magnitude of the problem, in 2020, UAB Hospital alone treated 666 Jefferson County residents for firearm-related injuries, the highest number seen in many, many years. It looks like they may match that number or exceed it in 2021 based on what we're seeing so far. One nationally published study showed that 44% of young people hospitalized for violence will return to the hospital with another violent injury within 5 years. 44%. And ultimately, 20% will die from violence. So I'm going to turn it over to Kari Adai to discuss our stakeholder engagement process from that point forward until now, as well as some of the further evidence base for Hospital Link's violence intervention programs. Ms. Dye.
Good afternoon. As Dr. Wilson stated, my name is Kari Adai. I'm an epidemiological analyst with the Jefferson County Department of Health. Before we get in stakeholder engagement and HVIP evidence, I think it's important that we look at the data. So during 2018 and 2019, African American men between the ages of 15 and 44 were more likely to die by homicide than any other disease in Jefferson County, which is significant when you compare it to other subpopulations. Currently in Jefferson County, injured patients are discharged to the same environment where they were injured without a viable strategy for how to stay safe, how to manage community pressures to retaliate, or even options to alter their life course trajectory into a more positive direction. And if you pull JCDH's 2018, 2019, and 2020 annual report, homicide was listed as one of the 10 leading causes of death in each of those reports. So with this knowledge, in March of 2020, conversations began between members and organizations to address the growing need for violence reduction strategies in Jefferson County. As a result of these conversations, the Community Roundtable was established, and we held weekly, in-depth conversations to identify programs that were evidence-based and effective. The Roundtable consisted of organizations and community members that all have a vested interest in violence reduction. Those organizations included Moms Demands Action, Faith in Action, Brandon Johnson, City of Birmingham's Office of Peace and Policy Director, JCDH, UAB Trauma, and a host of other community members who share the same goal of reducing gun violence and improving community safety in Jefferson County. During these meetings, we discussed a combination of options to reduce violence in Jefferson County, some of which include street outreach, cure violence, community-led public safety strategies, but also during this time, Everytown for Gun Safety had their eye on Birmingham. And this is because of the growing traction that we were receiving in the media due to violence. So Michael Sean Spence, the Director of Community Safety Initiatives at Everytown, mentioned HVIPs as another effective approach to violence reduction. And that's because services that pass through criminal justice systems and healthcare systems are often not well received by African American communities due to distrust. And it is perceived that these systems may have failed these communities in the past. So following a series of educational Zoom meetings with Everytown for Gun Safety, the Community Roundtable invited the Health Alliance for Violence Intervention, also known as the HAVI, who is a nationally recognized organization that provides technical training and technical assistance for HVIPs, to discuss the effectiveness of HVIPs with the Roundtable members on May 1st, 2020. As a result of these meetings, Dr. Jeff Kirby of UAB, a Community Roundtable member, recommended using the HAVI as a consultant group for Jefferson County, And following recommendations from both roundtable members and Everytown for Gun Safety, JCDH pursued additional conversations with the Hy-Vee and entered into a contract to explore the feasibility of a HVIP for Jefferson County. In regards to evidence, data suggests that patients who do not have access to an HVIP are 6 times more likely than HVI participants to be hospitalized as a result of violent re-injury. And according to the Hy-Vee, the cost of hospitalizations is 5 times higher for recidivists that do not have access to a HVIP. Survivors of violence are most open to behavioral change after life-threatening injuries, which is what makes it so important to meet patients while they're in their most vulnerable states. HVIPs offer a different approach to violent injuries by using violence intervention specialists to break down barriers by using people skills, shared histories of violence exposures, street cred, and cultural sensitivities to address individual needs and desires. To further look at the data, in a randomized control trial, predominantly African American men with a history of previous violent injury were half as likely to be convicted of any crime, 4 times less likely to be convicted of a violent crime, and 6 times less likely to be hospitalized for violent injury, translating into approximately $1.25 million in savings from prevented incarceration costs. According to the Hy-Vee, the most effective way to prevent community violence is to coordinate a comprehensive community-based approach that links various public health strategies to an HVIP. So that means that this program does not have to can coexist with other programs and does not have to exist alone. A comprehensive crisis management system creates an ecosystem of approaches that work. So states such as New York and California have established this approach in which they've included HVIPs in their violence strategy. And as a result, there have been 40% violence reductions in New York and 50% reductions in Oakland, California. To date, there are 40 HVIPs across the United States, and they are also located in 3 other countries. Dr. Wilson, I'll pass it back over to you.
Thank you. Nobody try to steal her from the health department, okay? So I just want to be clear, we're not pretending this is an end-all that's the end of violence or the only way to prevent violence. It is only one part of what needs to be a multi-pronged strategy, but it can coexist and complement other violence prevention programs. Among other programs that we considered and looked at, we do believe that this is one that has a lot of support. We feel like it's very doable and palatable to the community that we're trying to target. And we believe it's a good jumping off point, if you will, especially for those programs that involve violence intervention workers or community workers. And we believe there's a real high level of consensus around this. In the proposal you've been given, you will see a program budget on the last couple of pages. You'll see that JCDH is providing 100% of the funding for year 1. We have already budgeted $1.1 million that's already in our approved 2022 fiscal year budget to do this, and it is our intention to include that about $1 million per year in future funding. We think we can sustain that. This would allow a program to get started and be sustained. But it's also our hope that in subsequent years, this program can be expanded to serve more people with resources beyond what the health department is able to provide. So in this proposal, we're asking the city for an additional $1+ million each year for years 2 and 3 of the program to expand the program for a total of $2,164,575. And I'll stop here to see if there are any questions for either myself or Ms. Dye.
Thank you so much. We appreciate this information. Are there any questions from councilors? And I'll start on this end with Ms. Clark.
Well, Dr. Wilson and Ms. Dye, I first want to thank you for, spearheading this work. I think we really have to be, I'm just excited that the city is proposing to invest in a strategy like this that is non-law enforcement based, that sort of broadens our approach to addressing violent crime in our community. And I'm just curious, I didn't get to read all this in the instant that you gave it to us, so are there any goals for how many people can be helped? And I would imagine, I see you create the infrastructure for hosting the effort, but, is there going to be some network of wraparound services that could be available to assist someone who maybe doesn't want to return to the place where they were the victim of violent crime, or,
Yeah, so, and tell me if I'm not
I'm
answering-
assuming you're not a direct service provider. Your staff will help people connect with services.
Right. In fact, in all the community engagement we did, and for other reasons, we feel that this is not a program that the health department would run directly. We feel that it needs to be a community-based organization that has a little more flexibility.
Okay, that's the RFP.
And also, frankly, maybe more trust.
Okay.
And then in a governmental entity. But we will be we'll be putting out an RFP, and then hopefully we'll get lots of applicants, and then we'll do a granting process to an organization to run this, and then we'll provide some oversight and some accountability. The current plan, unless somebody comes up with another way to do this, would be to partner with the Community Foundation, where we have the Public Health Advised Fund, and that way they can help us with the grant administration and accountability part. The caseworkers that are hired, or the intervention specialists, they will have a target caseload of like 15 to 25 people per year. So we're not reaching a huge number of people per worker, but we've been advised by the technical assistance organization, the HAVI, to be very careful and very slow and deliberative in the implementation of this to make sure we get it right. Because if you don't get it right, you lose trust, and then it comes unraveled. But to answer the other part of your question, some of the funding goes towards a pot of money to assist people with emergency needs. So, for example, if somebody was living in an environment that's simply not safe, if they go back there, something bad's going to happen, we can help them with emergency housing assistance to get them out of that environment on, like when they're discharged from the hospital. And then there's there will be built a network around the primary organization that's running out of other organizations to provide these other services, the linkages to other services like mental health counseling or substance use treatment or job training, or to help people finish their education, et cetera. And there's funding built in to help with that.
So it sounds like this is a chance for us to adapt, improve the model for our community, and then scale it even more after year 3, potentially.
Right. And to be really honest, this will be a pilot. We hope it will succeed. There's a lot of evidence that, based on experience around the country, that this really can succeed. But we'll take it 1 year at a time. But we do want to take the opportunity with some of the funding that the city's received to enable us to expand it in years 2 and 3.
Thank you, Ms. Clark. Ms. Abbott?
Yeah.
And I know you. We'll just go on down the line. Go ahead, Mr. Moore.
So I know that you all obviously can't solve all problems, right? But I'm curious about in those instances where we have young people who have been the victim of gun violence and they were not the initiators, would they also be able to, them and their families also be able to benefit from being able to relocate in situations where violence has taken place?
So you're saying, make sure I understand, not just the person who was shot, but other family members?
Well, just that family, yeah, because I know I just heard you say helping people to relocate and not have to go back to a dangerous environment.
Right, the person who was shot. Correct.
Yes, yeah, but I'm saying if it was a young person, right, who was
Oh, I see. Who might be too young to go on their own?
Absolutely.
Yeah. We've had some conversations about which population we're going to focus, because as you saw, there were 666 people. We're not going to be able to serve all of those folks. So we are thinking about the idea of this program, at least initially, targeting people who are adults only, so not children like people under the age of 19. But certainly, to your point, if we were dealing with a minor, we would obviously have to help the whole family. Yeah, so that's a very good point. But we are, at this point, thinking we may want to initially target adults, and that's one thing that the hobby has sort of advised us to consider, narrowing that focus.
Gotcha.
No, I won't take that off. Can you understand me?
I have a little trouble. Go ahead.
Okay, can you hear me now? Okay, this is my question. You're only asking for money from the city of Birmingham, but there are 35 municipalities surrounding us. Are they excluded from this program, or do they get a buy?
I mentioned this in the proposal. What we're going to do is we have not asked others at this point. The majority of the gun violence that's occurring is in the city of Birmingham. And what we're going to do also is make sure there's an accounting process so that the proportion of people that are served is proportionate to the money that the city is putting into it, if that makes sense. So the city of Birmingham would not be paying beyond the proportion of Birmingham residents that are helped by this program. Am I making sense?
Well, except how do you know how many we're going to have? I mean, you're not going to say you've reached your number of 687 gunshot victims. The rest of these guys don't get any help, so...
Yeah, so we will not be helping every person who is shot. This program won't be big enough to do that. So there will essentially that we can monitor the numbers of people that are offered the program and that agree to be part of the program, and make sure that a certain proportion of them are Birmingham City residents, because we can control who we reach out to in the hospital.
Okay, thank you. And my other question is probably for the administration. We're being asked for $3 million, but you're saying that you want $2,103,312. So I'm not a great mathematician, but I can see that there's a pretty big difference between those numbers.
No, ma'am. We're asking the city of Birmingham for $21 million to expand the program in years 2 and 3. The health department is providing $3.2 million over 3 years.
Yeah, you said $21 million, and you scared me to death.
Oh, I'm sorry. My fault.
Okay.
2.1.
Okay, but we're being told that we need $3 million by the administration, so what's the...
Yes, so for clarification, the entire community-based public safety initiative is $3 million. Of that, 2.1 is potentially going to the Jefferson County Health Department. The remaining amount is just for other public safety initiatives that between the mayor and the council, and both the council and the mayor's office can sit down at the table to find other organizations that provide these types of service for this amount of money. Does that answer your question? That calculates the entire $3 million.
Okay, so the health department's going to have an initiative, and then we're going to have another initiative of our own?
Yeah, we don't want it just to work in just a silo just with them. So we have gaps, of course. So we want to be able to allow other people the opportunity to have their public safety initiatives implemented using this ARP funding.
Oh, the door-to-door model. Okay, I think I've got it now. Thank you. Thank you, Madam President.
Thank you. Dr. O'Quinn?
So I did participate in the online hobby sessions, and one of the takeaways from that is that effectively addressing gun violence is a multi-pronged approach, and hospital-based violence intervention programs are only one facet. I do think that we need to be, exploring other mechanisms as well, other strategies. But it would seem to me, and you can tell me if this is accurate, there's a lot of, this is a national conversation, and Congress is, allocating dollars specifically to address this issue. It would seem to me that implementing this type of program here locally would better position us to be competitive for additional federal support. Would you say that's accurate?
I would hope so, yes. I think I would assume that would be helpful. And again, this is something we have to start slow. We can't move it too fast to make sure we get it right. But my hope would be that it could expand significantly with local funding and federal funding over time, because there are a lot of people that need to be served through a program like this. And then additionally, there are other programs that need to complement this, because this is after somebody gets shot. We need some more primary prevention or intervention right before violence takes place.
Okay, thank you.
Thank you. On this end, do we have any counselors that have any questions?
Yeah.
Mr. Williams?
Thank you, Dr. Wilson. One quick question. And I might have misunderstood a comment that you made at first, but this has not been in place yet, or we do have a year behind that this has been in place?
It is not. It has not been started yet.
Okay,
That's
but
right.
there was a...
So we're going to be, in the next month or two, issuing a request for proposals.
Okay.
And we've already committed funds from the health department for the first year.
Okay.
And we will have to find a community organization that can run this program. And they will have to hire people to do it. So some of that could take time.
Thank you.
Thank you. Go ahead, Ms. Tate.
Hi, Dr. Wilson. Dr. Wilson, what is the chance of, I know you said that you guys were going to be partnering with other organizations to do this work. What is the chance of getting some people that do restorative justice and healing circles in the mix of this gun intervention? Because I'm just a proponent of, restorative justice and healing circles and peace circles. Seen a lot of great work done with people across the nation that does that great work, and just like implementing, these opportunities, with organizations that do that, and bringing, like maybe reaching out to some national people that have healing justice and restorative background, coming in and training, community members, to implement this with the gun violence intervention.
Yeah, I have to admit that's something I would need personally more education on myself. I think that this program, there's a certain model that you follow that has to have a certain amount of integrity, but on the other hand, it's very fluid on the edges to where you can add in other resources. In fact, we need more resources for the people that are engaged in the program to help them with that healing process. So I would assume that it could be, this could be another resource that could be a wraparound, if you will. But I would love to talk to you later about more what you're thinking.
And before we go to the next counselor, I do want to just be sure that we do note one of the items under this also says additional community-based public safety initiatives at around $896,000. So it says to be identified. So I'm assuming that there may be opportunity in there for these type programs. Is that correct? Okay. All right. Thank you. Councilor Woods, and I'm going to let you do that.
Thank you, Madam President. Did want to just say I'm excited to see this get some legs. Like, I've had an opportunity to kind of listen in on the community roundtable conference calls for seems like a long time. So really excited to see some movement, seen a lot of presentations, and so
there was a little thing called the pandemic.
Yeah, so we talked about it for sure. So glad to see it getting some legs on it. Wanted to say, you might have mentioned, but did you have a timetable over as far as getting this stood up and kind of getting operational?
Yes, sir. Like I said, working with Community Foundation, I think we'll probably be putting out requests for proposals sometime in January, realistically after the holidays. And then we'll have to think about how much time to allow the proposals to come in. It probably would be in the range of 4 to 6 weeks. We want to make sure that we get as many organizations that want to apply for this the opportunity. So if a little more time is required, we're good with that. And then, yeah, there is a timetable. I don't have that with me. I think you all were sent a copy of the slides that were in one of the Hobbies presentations. In terms of implementation, there's several phases of implementation, but there's, you have to hire people, you have to train people, and that takes quite some time. These violence intervention specialists have to be trained and trained well. So I don't have the exact numbers in my head in terms of that timetable, but it would probably be towards the end of, or the latter half of this coming calendar year before we're seeing boots on the ground intervening in people's lives. Does that sound right to you, Karia? Did I answer your question?
Right, yeah, I just trying to get a roadmap. And then also, what kind of reporting or kind of is built into this program, and how often will we, the council or the public, kind of get feedback on what's going on?
There will be there is a data component to this where we'll be working with somebody to help collect data, certain metrics, to, so we can see how the program's doing, get more information. In terms of, we want to report back to you all if you're going to be funding this, and that's at your pleasure, whatever would be appropriate. In fact, we could potentially, the mechanics of an agreement that we would enter into still need to be worked out, but we could put into an agreement that we shall, report every so often. The health department and the entity that would be running the program, they would be required to report to us periodically, as well as Community Foundation, on how they're doing, and also in terms of invoicing for the actual funding. But that would be, whatever your pleasure is as a council, in terms of accountability for us.
Thank you. That's yours, Councilor Pro Tem.
Thank you, Madam President. Hi, Dr. Wilson. It's good to see you. I'm really excited to see something like this happening. I know I've talked with Brandon Johnson. I think I've harassed Kelvin Datcher about this, but I do have a question. So I know we have about $900,000 that will go towards other programs. And I guess with the staffing that we have from the health department for the part A of the piece, how would that work with the other programs? Because if you look at other models, and not just Secure Violence, any of them, they have in there where you have to hire these type of people for their program to work. So are we assisting them? Can you explain that? And can you also explain how would you determine which organizations will get this money? Because it usually takes $250,000 to run a program. If we only have $900,000, that's what, about 3 or 4 organizations would realistically be able to implement their strategy.
So thank you for the question, Counselor. So just to kind of clear up the confusion here, so there is a top line figure here that is, $3 million. Again, that's not $3 million simply to the health department. It's a top line focused on the community-based public safety initiatives overall, of which this is one. To your question, Counselor, President Pro Tem, the remaining 900 roughly would be allocated through a competitive RFP process that we would run through the city, similar to other grant-making programs that we run, like the Bold Grant Program, et cetera. And we would envision, to your point about sort of how many programs that might support, et cetera, we'd work closely with council to define the parameters of those RFPs based on your priorities, to work through how those proposals might be scored, et cetera, and how, for example, this allocation in the first tranche of ARP funds might inform a second tranche, might inform other programs down the line that we could apply for under competitive grants from the federal government. So we really see that as seed money for future efforts in that space.
So this part for the health department, the strategy really is what Hobby is doing. Is that correct? And so y'all would implement the hobby strategy, and then if you have other strategies outside the hobby one, you will apply for the 900,000. Okay. I just want to make sure I understand. Okay. I don't think I have any other questions, but I do know it will take 18 months for us to see realistic results. So I am very excited that we get this up and moving. Thank you.
Thank you very much. I do have just one question I just wanted to clarify. The program itself, and this is more towards Dr. Wilson, and thank you all for bringing this to us. I'm equally excited to see us be able to start this, and I think all of us want to get this implemented and get this out here as a means of some type of prevention or intervention. Are the participants in this program, I know you said often the victims, they may go back. Sometimes it may be a violent situation or living conditions. So are we assuming that anyone in this program is a victim of crime, is not an innocent victim of crime, where they are not part of this? Who are we helping here? Because there are other victims of crime. Let's say someone comes up and robs me and shoots me and leaves me for dead, and I'd survive. Would that person be a part of this type program?
Potentially. I do think, and I don't know that I can adequately answer your question at this point. The hospital, they have their own employees that will be identifying potential participants, including like a social work type person, that will then connect with this program from the outside coming into the hospital. So I think there will be some discretion on looking at, like, is this particular gunshot wound victim somebody who is at risk for recidivism, at risk for retaliation? Are they in that kind of environment? Versus, somebody who was randomly shot on the street, or maybe the victim of a robbery that was not in that sort of environment of a violent culture. So I think, in my mind, we would have some discretion there.
Okay.
Does that?
That helps me, yes.
To make it make sense.
Yes.
Yeah.
Thank you very much. And then for administration, we talk about the other piece of this, the almost 900,000. Any timeline on when those, would that be an RFP type process as well?
Yes.
And any mention of when that might start? I know we've got the holidays now, but will it look something like maybe bold or just RFP?
It would literally mirror the bold RFP type of program, but like we will work with the council to make all the parameters fit between what the council wants and what the mayor wants.
Okay, thank you. Any other questions, councilors? Anybody have anything that burning to ask again? All right, we appreciate this. We're happy to see this as part of the model, so thank you.
Thank you.
We'll let you continue, Ms.
Our colleagues from the Health Department for presenting. So the next item under consideration, again in your packet, is related to City of Birmingham operational and facilities funding support for the World Games. And Chief Mitchell will speak to that item.
So, thank you, Madam President, and Madam Pro Tem. So in your packet, as we emailed to you, was the outline of the budget for the World Games per department. So this funding is not directly going to the World Games. It is for the city to get in preparation for the World Games. For the new counselors, we entered into agreement with the World Games to host the World Games in 2021 initially until COVID happened, and so now it's in 2022. So this, the agreement basically spelled out that the city is obligated to do a number of things. Besides paying them $3.5 million, we are supposed to have security measures in order to host the World Games. The other thing in the agreement also spelled out that we did not, as a city, have to build any type of facility, that they were okay with the facilities that we had already in our inventory. So the money that's before the council is funding that we need in order to get basically our house in order before the World Games comes to Birmingham. So council, for a point of privilege, I would like to even bring up this. We can knock out two items at the same time because I know we have a World Games update. So I want to show the council that what we're working on, besides the money piece, is the interlocal cooperation that we have to get ourselves in order, especially when it comes to security measures for the World Game. So if you allow me, I'd like to bring up Mr. Jim Coker, who leads our Jefferson County EMA, and Mr. Chris Tate, along with Chief Kevin Moore and Don Lupo, who and myself serve as incident commanders for the incident command post. So we just want to give you a brief update of how things are going and how we are being prepared, along with the county, our federal partners from the Department of Homeland Security and the FBI. So I'll let Mr. Coker take the mic.
Thank you very much.
Thank you, Mr. Mitchell. Good afternoon, everyone. And
Good afternoon.
I will make this brief. This event, the World Games, is the first ever event of this level to see the state of Alabama. Alabama's never had a Tier 1 rated event before. With the Tier 1 rating comes a lot of federal support. It comes a lot of local and state support. And we are seeing this across the board. We are seeing extensive efforts by our local partners to support the city of Birmingham. We are seeing extensive efforts also from state departments, such as the Alabama EMA, ALEA, and others to provide support to the city. And then our federal partners, because of this rating, the SEER rating of 1, it brings a lot of federal support. It does not bring any federal dollars with it. It does bring assets and people. So this is an ongoing planning process. Many city employees are involved in the planning every single day, because if you consider how many different venues, how many sports we have going on simultaneously, this is not like the Super Bowl when you have one major event that goes on for one day with some prep time and takedown time. This is many different events at many venues all over 2 different counties, primarily inside the city of Birmingham. So Don and Kevin and Chris, I would invite you to add any comments here. As they come up, I will say this. This is an organizational challenge. So we decided very early, we as all of the agencies that are involved, to utilize what is known as the National Incident Management System. This is the national model. It uses ICS, which is the Incident Command System. And basically that is a way to make sure that you don't exceed the span of control and everyone knows who to report to and what my job is. And that is really the only way to manage something of this nature. Gentlemen?
My name is Kevin Moore. I serve as the Chief Financial Officer for the City of Birmingham. Just wanted to add to what Mr. Coker was saying and actually thank Mr. Coker and the EMA because they have been very supportive. This process of planning has been going on almost probably 2 years. My first training exercise was actually in Jacksonville, Alabama, the month before COVID hit. So we began planning and getting training all the way back then. It is a cooperative endeavor. We are working with federal agencies, state and local municipalities, and we're going to continue to bring on more people. As a matter of fact, we have a meeting tomorrow. We have a meeting Friday. We have, while we were sitting in here, we got 2 more meeting notices. There's a lot of planning that goes into this process. As you see, we do have a budget. A lot of this is tied to our facilities. Our facilities need some improvements to prepare for the World Games. On the bout well list, there's one particular item that is used to keep people from running into your facility. Because this is a Tier 1 rated event, we do have to protect our entryways and our facilities differently than we do for a regular event. So we will do some things differently. Security is going to be the #1 priority, safety of our patrons as well as our citizens. The perimeters of facilities are going to be look totally different than what you see in a normal event. And so I just wanted to give you a little heads up of what is going on and some of the things that's within the budget. If there's some particular items, we can answer any questions. Did want to talk about the fact that we met with a couple councils yesterday. The Unified Command is a very extensive and detailed structure, and it includes many planning pieces that go from operations, planning, finance, all types of different section chiefs that will be working together to bring this event together.
Thank you. Do we have any questions from any councilors? All right, Dr. O'Quinn.
Thank you. So in the proposed use of ARPA funds, this is $5 million. So looking at the budget needs or the budget request that Mr. Mitchell provided earlier this afternoon, that dollar amount is $7.5 million. So what are we not doing in the budget request?
So you're speaking to the difference between the request and what's in the budget. So I can speak on that. So when we first made the agreement to host the World Games, there was a $3.5 million commitment that the council approved out of our Birmingham fund, which for the new council, that is our rainy day fund that we have from the sale of the waterworks proceeds. So throughout the budgetary process every year, the past administration, we had a $500,000 allocation that we made every year to get to that 3.5 commitment. So that actual allocation was done in the general fund. It wasn't paid out of the Birmingham fund. So we technically still have that 3.5 million line item that sits in the Birmingham fund dedicated to the Birmingham the World Games 2022. So the difference between the $5 million request in ARPA funds and the 3.5 that we have in the Birmingham fund will give you the $7.5 million that we would need.
Okay. I might need to see that on paper to make that.
Yes, sir. I will be glad to share the ordinance and everything and show you where it is in the Birmingham fund report.
Okay, thank you.
Thank you, Dr. O'Quinn. Any other questions? Ms. Abbott?
Yes, shouldn't have touched that. My question is, which category of ARP allowable uses does paying for the World Games fall into?
So I'll let Ms. Amelia Miller answer that, but just to say we're not paying the World Games. We're actually, it's all internal for the city of Birmingham, not for the World Games Foundation or Federation. This is strictly for the city of Birmingham. I'll let her explain just the reason behind it.
So one of the allowable uses under the interim final rule for the ARP funds is revenue loss recovery, which we've talked about in the previous iteration of this council. Those are essentially expenditures that are ones that the city would have made under sort of normal revenue circumstances, but for the economic shocks of the pandemic. So these investments in city facilities are ones that we would have made in preparation for the World Games had we not tightened our belt to make things work during the pandemic. And so we're really kind of catching up on those facility needs. And what's really wonderful about this proposal is that these are investments in these facilities that last long beyond the World Games and will have longevity, much past July 17th of next year. So it is, with assurance, an allowable use under the interim final rule from the Treasury.
Okay, so it's the replace lost public sector revenue.
Yes,
that is correct.
Okay. That's all I wanted to know. I certainly don't want to, I know we're getting lots of really neat stuff with all this money, and we'll get to use it once the World Games have gone back to wherever they came from, but, I'd hate to have to pay it back.
Yes,
so
ma'am.
I just wanted to know.
And between Ms. Muller and our grants division, we make sure that we vet all the allowable uses to make sure we don't have to pay anything back.
Good. Thank you.
Thank you. Councilor Clark?
Just curious about the plan to execute these things. I can see a lot of them are sort of material purchases, but some of them involve, doing some work to the pools and tarmac at Legion Field and so forth. And I don't know if they will be performed by our maintenance crews or if it'll be contracted out, and if you have time to put the bid packages together and all that stuff.
So most of the big ticket items that we are trying to procure will be procured using our cooperatives that we're allowed to use. That pretty much takes the whole bid process out of the whole process of procuring anything. Just like I think Tuesday, Ms. Abbott asked a question about one of the co-ops for the fire department. We have many co-ops that we are participating in and memberships of. So we literally can go on the list and pull off all the things that we have on the list and just buy it straight out without going through a bid process.
Okay, so that takes care of, that takes that bid time out of it. But I think there's supply chain impacts from COVID too. So sometimes, even though you don't have to bid it out
That's
you
correct.
have a unit price, it may not get delivered or it may not show up. So are you all going to be wide open trying to get this stuff?
Yes, as soon as we get the money, we are moving on, because everything on this list, we have quotes already established, so we're ready to move. As long as, once we have the funding in place, we're ready to go. And also to that point, Madam President, we will request and send it through Budget and Finance to request to make the World Games a public purpose, so we can also, that would really help us out to expedite a lot of the requests.
Thank you. Any other questions, counselors? I'm asking on this end. All right, Dr. Quinn.
So certainly some of those things that are in the budget don't fall under the ARPA category. So like $1 million for shuttle services through the Department of Transportation. So I assume that portion of the funding would come out of our general fund or whatever, the remaining balance that you talked about a minute ago?
I think, go ahead. I'm sorry. Yes.
James Fowler is welcome to come up and add to this, but months ago we did work with Callaway, did some work with us on building the scope for us for the transportation shuttle service. And where we're working on now is an RFP to put on the streets to get a shuttle service to work the World Games. That's what the $1 million is set aside.
So Councilor, I think to add on, it's under the allowable uses that Ms. Mueller has already explained. So if we didn't have the COVID that happened, it would have originally came out of the general fund, or a request would have came from the use of the Birmingham Fund to offset these costs. So under the allowable uses, we're allowed to use this money to hire consultants for the transportation system.
Okay, so it's not exclusively for stuff that we would have done anyway. So like, their IMS is requesting a video wall, so I'll make sense of it, but that's.
We can have a deeper dive to discuss, because it's a lot of things under allowable use and allowable use that this, like I said, we vetted this to make sure that we can purchase and procure these things under the ARP.
Okay.
Thank you. Any additional questions? All right, we'll go to the next category. Thank you.
So the next top line here is related to community and economic development broadly. And I would say, just to kind of tee this up, we're really trying to think about a suite of initiatives in which we're marrying work in kind of core economic development and core community development. We all know retail follows roofs, so we're trying to be more strategic about how we put those together in our recovery plan here. So you'll see a number of line items within this. I'll give the top line overview, and then if we want to dig into any of these individually, I can call up specific colleagues to speak to them. So the first is COVID response for existing small businesses. So that is a proposal to provide grant-based funds to high-touch industries that we know are still struggling to recover from the COVID pandemic. That's barbershops, beauty salons, other high-touch industries that would be distributed in a grant-based fashion. The second is microloans for new business starts. We know that the sort of friends and family scale of financing is some of the most difficult for entrepreneurs to obtain through traditional lending. And so in partnership with a third party, we aim to provide microloans for new businesses to start. We know that while the pandemic has been a real strain on many existing businesses, it has also been a time of significant entrepreneurship as well in our community, and we want to sort of balance out both sides of the scale with those efforts. The next item before you is related to site acquisition and site remediation. So some of this is core economic development work that we do on a routine basis. So there are a number of sites that are kind of, we have our eye on in terms of acquisition, as well as one or two that need significant remediation work, which my colleagues can speak to in more detail. Next before you is related to attracting conferences and conventions. So not just the sports and entertainment side of things, but that's attracting sort of big scale conventions that can drive economic growth in our city through those visitors. Next up under that line item relates to reimagining shuttered schools. We know there are a number of schools in neighborhoods throughout your districts that are sites of interest for redevelopment. Some of those we believe that the free market may be able to sort of handle, if you will, in terms of development opportunities, but a number will need careful study in order to develop models that we think can work for those sites. And so the funding item here is really to think through those strategies in a comprehensive way for those school sites. Next up relates to affordable homeownership, so helping to meet some gap financing so that a number of new single-family homes that we're building can be attainable to individuals who have difficulty obtaining just sort of that last mile of financing, if you will, for those homes. That would be on the sort of development side of those deals, as well as other initiatives that we're working through in public-private partnerships. Next up is related to homelessness support. So we know that there are a number of organizations out there working to address housing insecurity and homelessness who really lack the capacity to really front cash on many of the programs that they might say otherwise be reimbursed for from federal programs and otherwise. So we want to give them the opportunity to apply for grants through us that can help them to do some of that work that's otherwise difficult for them to obtain some of those bigger grants for. And then lastly relates to specific allocations for council districts that we would work closely with each of you to identify projects that you could target those funds toward and to identify partners with whom we could further develop those projects and additional funds to bring to those. So that is a very high-level overview of all of those items. I realize I spoke quite quickly to those. I'm happy to call up colleagues to speak to any of them in detail for your questions and concerns.
Any specific questions or clarification needed for this particular section? Councilor Williams.
Thank you, Madam President. For the affordable homeownership, I know that we've had discussions about better ways to utilize the land bank and looking at instead of having, basically, one side lot here, one side lot there type of thing, having an entire group being looked at for redevelopment. Is that what that's for?
I'll pass it to my colleague, Mr. Datcher.
Good afternoon, Councilman. Really what we're looking at is developers who are ready to come to market already, right? But if we look at areas that are that are tough to borrow in, right? So there's typically a gap between what people can borrow in certain neighborhoods and then what the actual cost of the home is. And so we want to fill that gap. Right now we're building 27 new homes in Bellevue Heights. Councilor Clark, they're going up right now. I was actually out there today. Those houses are 1,227 through 1,350 square feet each. And they range in price from about $179,000 to $203,000, right? We can make that account affordable by putting a subsidy in there that meets the difference between what people can actually borrow and what the price of the home actually costs to build, right? And the great thing about that is folks walk into the house with $20,000 in equity day one, right? So folks are less likely to walk away if they fall behind. They're going to be more creative, more resourceful in terms of staying in that home, and it provides some stability in our neighborhoods that are otherwise not getting the kind of construction that they need. I can't tell you when the last time a new home was built in Bellevue Heights, but you got 27 of them coming up right now. There are also parts of Woodlawn that are going to get homes. This is through a $25 million commitment through NCRC growth in the city. And now we're also targeting other areas using the land bank model as well, Councilor, bundling those kinds of lots because we can't do the onesies and twosies anymore, right? We've got to do a level of construction that causes a real impact, right, in a community that springs it forward, right? No more pebbles in the ocean. We got to throw a big boulder in a lake and make a splash, and that's what we're seeking to do. So right now, that subsidy would be about between $20,000 and $25,000, which would get you 40 to 50 homes in this tranche right now.
So that 25,000 or 40 to 50 homes, so that's just for random people to apply and obtain. It's not to look at a community as a whole, right?
I'm not sure what that means.
So with the 40 homes, it's not going to be, is it or is it not going to be targeted to a specific geo-fenced area?
Yes, sir. We're going to be targeting areas that are hard to finance. Absolutely. We're not going to be subsidizing homes downtown and Parkside, right? We're going to look in parts of our community that have not had the kind of construction investment that the market would otherwise create. We're going to partner with citizens and with financial institutions to make that a reality, right? You could not have financed this kind of a home in Bellevue Heights at this price without our subsidy coming in. And we're going to have 27 new families that are homeowners in that community. It's going to bring some real energy and vibrancy there. And we're looking at other parts of that of the city as well. And the reason why we combined community and economic development is the city's always done this: economic development over here, community development over here. Residential and retail have to combine and go hand in hand. Because somebody's going to open a business, they want to know that somebody can walk to that business. If someone wants to buy a house, they want to know that they can walk somewhere and buy some groceries. So that's what we're doing. That's our model. Bellevue Heights is that example. It is actually happening, right? It's not something in theory. That construction is happening today. You can go by and see it on the corner of 51st and K. And we're happy to meet everyone, meet out there or talk to our partners, our national partners at NCRC, to talk about how we finance that totally.
All right, thank you. Does that answer your question?
Yeah, so I guess none of it is going toward. So do we have any commitment to the land bank at all in any of this?
Not in that particular line, no, sir. That's not in that line.
In any of the line items? No land bank?
No, sir.
Okay. So it's not, just to clarify, it's not to look at, an area. It's okay.
No, sir. It's to look at areas. It's not to look at land bank individual lots. So we're still targeting areas that have kind of these kinds of deficiencies in terms of the ability to finance them. But we're looking at absolutely at areas that have been underdeveloped and under-focused.
So this would have to be new construction then?
Yes, sir. That's what we're looking at.
And so the only new construction we have in these areas is Bellevue Heights and Woodlawn?
That's first.
Well, Bellevue Heights and then going to be Woodlawn,
yes, sir.
I guess.
That's first. Yes, sir.
Okay. So I guess these are exclusively for Bellevue Heights?
No, sir. Not at all.
Well, then what's the timetable in which these funds have to be dispersed?
Right now, we're actually, as a matter of fact, it's Corey here, but we're looking at, we'll have to talk about it, two different parcels in Pratt City. One Pratt Park, we know that folks want to live near three things: schools, libraries, and parks. We have one Pratt Park, which is a phenomenal amenity. It's going to attract folks to Pratt City, but we need to help them build some homes in that community. And so that's one of our next target areas. So we're looking at places where the city's already invested that we can double down and leverage city dollars to make the most out of them. These are precious city tax dollars. We want to make sure that we maximize every dollar that you entrust us to spend.
Okay, so my question is what is the timetable that these funds have to be expended?
So this is December 31st, 2024. But, Councilor, this $1 million is going to be gone in a matter of months.
Mm-hmm.
So if it's going to be gone in a matter of weeks, then it is exclusively
no,
for
sir,
the
we're going to
Bellevue
continue
Heights.
to grow, Councilor. We're continuing. There's 27 times.
So it's going to be gone in weeks. We only have houses in Bellevue Heights.
Yes,
okay,
27
so
times.
it's $1 million for Bellevue Heights. Got
27 times 20,000 is 540,000, which will leave $460,000 left in that subsidy.
Councilor Clark did want to have a clarification.
Let me just say to Councilor Williams, don't hate. Hey, if this
I'm not hating them,
Hey, if this can work in Bellevue Heights, it can work anywhere. But what I want to offer, as I'm hearing what Datcher, don't leave. It sounds like it's for soft second mortgages that might be forgivable, and I'm not really sure over a period of time. But what I've seen when people start to build in our neighborhoods, they're not always sure what the appraisal's going to bring or what the homeowner can afford. Is somebody who can pay the full price going to try to move here? because it's somewhat speculative. You know, the house costs what it costs to build, but you don't really know if that market rate person is going to come and try to buy this house who can qualify for the full amount. So having that reservation, that ability to put that soft second mortgage on there will make it affordable if that's all who's, you know, if the list to buy this house is people who can't afford the full mortgage, then you have that sort of backstop. And so the first time I've seen it done, just in my experience, was in Norwood, where Alethea House was doing 8 houses, and they had a reservation of up to $25,000 per house to be available if they needed it. But what happened is people like Chris Hatcher came in and they wanted the house at the full value, and they could qualify. And so they really never used that money. It was there as a backstop in case the market didn't really turn out and show up at this location to buy houses that are valued a little higher. So it's a cushion, it's a safety net, if you will. And I think if I think they're doing 28 units in Bellevue Heights.
27 now, 27.
So if that ability to, say, the fund to fund those soft seconds is there as a backstop for them and it's not needed, then it just transfers. And I don't know if you're going to will they pay back the soft second, or is it forgivable over time?
This is a grant between the homeowner and the developer. And see, we're not paying it to the homeowner, we're paying it to the developer, because we were trying to incentivize them to do big projects, not
so you're trying to buy down.
Yes, ma'am.
So
exactly.
The other thing I want to say about NCRC Grow, as a former Community Reinvestment Act banker, is that they have a lot of money to do a lot of homes, and so they want to do like 200 in Birmingham. So there's opportunity for everybody to.
$25 million. This is about 7.89 million of that 25 million. Yesterday, they broke ground in Atlanta on $90 million in new construction. And so I kind of yelled at them today. It's like, hey, we want some of that. They said, we've got more. And
I just wish the number was much bigger. That's all.
That's where we're headed.
That's all I say.
Yes, ma'am. We're going to make it real, so you'll double down with us.
Okay, got to start somewhere. But we got to really invest in this, y'all, I think, because we have too many vacant lots that we have to mow.
Thank you.
I agree, which is why I was asking if it was in a specific neighborhood or not. But now that we know that it's going to a developer, how about this? Mr. Mitchell, can I please get a list of, after this funding is expended, of where the 40 units went, knowing that it's not just going to Bellevue Heights?
Yes, sir. I will provide it to the entire council.
I do have a follow-up to this conversation.
Yes, ma'am. We're looking at District 7.
This again is, I was giving you the side eye. I really was. D7.
Yes, ma'am.
But what I did want to ask, again, this is the first, what do we call this, a tranche.
Yes, ma'am.
So nothing prevents us from the next allocation that we see the success of this, correct, that we could put monies into and we keep investing and doing this, even with the second set. Is
Yes,
that
ma'am.
possible?
The mayor's asking us to move with all due urgency on this first tranche, what's remaining. So, because quite frankly, lots of these projects are pilot efforts that can be scaled with further investment, right? And so we'll talk about one in Via in just a few minutes. This is absolutely one of those, because if we can come to market with that kind of a subsidy, we are a much more attractive community to developers, not just local ones, but all across the country. I mean, literally, we are competing. We got NCRC's attention. They literally dropped $90 million yesterday in Atlanta. And so that's the kind of relationship and the kind of reputation that we want to show that we have as someone who can work with those kind of developers.
All right, thank you. Any questions, again, on this particular, Dr. Quinn?
Yes. So thank you, Councilor Williams, for touching on the land bank issue. Mr. Datcher, as you and I have discussed, we have got to do something to clear title on these tens of thousands of vacant properties or tax delinquent properties across the city. We cannot get a developer to build a house on it if we can't clear the title. So I am putting in my request early for the next tranche when we get the next $70 million. Please, let's consider ways of jet powering the land bank process and getting, instead of 600 titles on 600 properties cleared over 6 years, let's be doing 600 every 3 months. We need to be on a pace of clearing titles on thousands of properties on a regular basis in order to just keep up with the influx of new tax delinquent properties. So, and again, we can't build new housing on property that we can't clear the title on. So, putting in my request early for Tranche 2.
Yes, sir. Chief Chaz Mitchell is in charge of that list, so you can talk to him.
But I did have another question. So, in relation to Daniel Payne Industrial Park, there's been a lot of turnover, unfortunately, but under the previous director of IEO, the council approved a significant investment in grubbing and grading out at Daniel Payne, and so I'm just a little disappointed that we have to make, another investment there. So can you kind of explain, my impression was that Daniel Payne was a greenfield project, not a former, industrial site. So please to explain to me, why we have to do remediation there.
So Mr. West is going to come up and he'll talk to you, but there's 100 acres left yet to be developed. And when developers want to come to town, they want to see pad-ready sites, right? They don't want to see something that they got to imagine what it's going to look like after the work happens, right? They want to see pad-ready sites. And so Mr. Wesley's much better at this than I am.
Good evening, Cornell Wesley, Director of the Office of Innovation and Economic Opportunities. Specifically to your question, very simply put, there are landmines on those 100+ acres. You're right in your assessment that work was done and invested, but unfortunately, it was not clean, it was not remediated. And so in order to get those 100+ acres back working for us, we have to remediate that site, and that's going to have a significant cost to it.
So you're saying there were mines on the site? It's a former mining site?
It was a U.S. Steel property that we had owned. So you may be thinking about a different property that's in the Daniel Payne area as it relates to the industrial park. This is outside of the industrial park. It's 100+ acres away from that. So again, you're correct in that investment was done. But in order to get the crown jewel of our industrial holdings ready for development, we've got to make this investment.
Okay, thank you.
A pleasure.
Thank you. Any other councilors have any other questions? Ms. Clark?
Well, Mr. Wesley, so you're saying this 100 acres is outside of the Daniel Payne Industrial Park, or it's undeveloped inside of the Daniel Payne?
Exactly.
Okay.
Exactly.
Council Pro Tem.
I think this is probably for Datcher more so. I am excited that Bellevue Heights and Woodlawn will give affordable housing opportunity for that. I just want to make sure with the, no, I have TDC and Navigate. District 6 is good. But every district like mine doesn't have nonprofits that will invest into affordable housing. And I guess I want to make sure that we say publicly the next time we want affordable housing to touch the other 8 districts, because this money is for citywide. So I think a lot of the concerns, I can't speak for the whole council, but a few of us, is that we want to make sure these dollars go into our districts and that there's equity when these funds get distributed.
Absolutely, Council. And we'll say this, like previously when the city built 9 new houses, they would put 9 houses in 9 districts, right? We do one here, one there. And so there's no real impact from that, right? Mm-hmm. So what we've got to do is we've got to make the bigger splashes. We got to work with developers on larger properties to get folks moving, and we can change entire communities, right? So when we go in with 28 houses, 27, 28 houses, then we can come in with the sidewalks and the streetscapes, and we're moving a whole neighborhood to scale at the same time. If we're doing one house, it doesn't make an impact. That one house does not make another family want to move into the second house, right? We've got to do 20 houses, 30 houses, so that then 10, 20, 30 more families want to come in the neighborhoods, right? We got to bring this to scale because the micro building that we've been doing simply hasn't worked. And I mean, the results are obvious in every district around the city. So nothing is exclusive to any specific neighborhood because, quite frankly, we have activity going on all over the city, right? This one is just particularly for home ownership. Right now with the NCRC, there's not a developer in the city that we were able to bring $25 million in committed cash to the market. Our federal lobbyists help us connect us with NCRC. We nurtured that relationship for the better part of 2.5 years before they made that leap of faith in coming into one of our communities. The great thing about this project in Bellevue Heights, it is now a showcase for what we can do in the rest of the city, right? If we do it right here, we can do it everywhere. And so that's what we're showing developers, right? Come see us, we can get it done. And so this is just a start, right? We got to start somewhere. And it was just this turns out to be one of the best places because the city owned the property at that time.
Okay. Wait, I'm not done. Come on, Council Clark. We gave you 3 times. Well, no, I'm just going to make a comment about the land bank because the land bank is an important piece of affordable housing. And I know a lot of people have applied to get land bank property and they are struggling to get it and they're getting discouraged about it. And the land bank is something that touches all 9 districts. I don't know if that's something, Mr. Mitchell, we can talk about during budget season as well to see if we can help them out, if there's room to help them out, if we can't use these funds for them, or just see something else. I think this is a good model, y'all, for our budget process as well, because we can see our priorities on paper and then see how we can make sure the budget reflects the priorities of all 9 districts. So thank you, Dasher.
Thank you very much. Did you just have one more follow-up?
Just one more question. I guess this is for Datcher, but I'm trying to figure out, I guess all the talk about the 1 million kind of, and learning later that it's going to the developer, not to the home purchasers. So are they somehow impacted? I know we've already started this project, so why are we inducing something that's already in flight? Have they been impacted by COVID somehow?
No, ma'am, but the residents have, right? Well, this is what we know. We can still probably sell those houses to families that can qualify. We could probably find 27 families to move into those homes. But are those the families who the city needs to help, right? We've got to identify families that need our help, and those families are coming out of the woodwork. So before they even dug one shovel in the ground, they were getting dozens of calls from families that are at the margins.
That
right?
can't qualify.
Yes, ma'am.
Okay.
We're working with the Housing Authority. We're going to get families from public housing into home ownership, right? That is what government ought to be doing, I think.
Okay, okay. I was just wondering why it was going to the developer, to buy down the mortgage so that people who want them can afford it. Okay, so nobody's showing up who's got the money to buy the house.
Well, I'm sure some of them are, but this is who we're
That's who we're targeting.
Okay.
All right, and Councilor Woods did have a question.
Thank you, Madam President. I wanted to ask a little bit more about the homeless support piece.
Counselor?
And just get a feel for, like, specifically what we're trying to impact with those dollars and how we're going to go about that.
Sure. So the initial intent of those dollars is to really focus on organizations that are serving individuals experiencing homelessness, but that are organizations that are at a scale where they have difficulty pursuing bigger grants from, say, the federal government or sort of outlaying significant amounts of capital. So in many ways, speaking back to Councilor Smitherman's point on the public safety point earlier, one of the things that we see as a real opportunity through these ARP funds is to catalyze organizations that we want to build capacity in, that we want to stand up for opportunities for future investment from the city, from other national partners, from federal grants, et cetera. So our intention with that is to really focus it around grant making to smaller organizations focused on people experiencing homelessness.
Okay, so you're looking to use this money to give the grants, or will we use this as like match money for organizations wanting to apply for grants? I know like one of the issues they have is a lot of times they don't apply for grants because they don't have the match money if they get it. And so
To your specific question about match funds, because these are federal funds, there are a number of sort of legal entanglements to this about whether or not they could be used as matching funds. So our intention is to really make them grant-making funds and not matching funds, just given the sticky nature, shall we say, of federal funds matching federal funds. Typically, that wouldn't be allowable with these.
Right. And then just to kind of circle back on what a couple of my colleagues have mentioned, I've just recently went around and talked to like several of the homeless or organizations that focus on homelessness, and what they're saying is like affordable housing is kind of their biggest issue. Is if we can impact that, then we'll help them we'll have more impact on what they're doing. And so getting the land bank, I think, is the opportunity to almost kill two birds with one stone, because we have a lot of properties that, with reasonable investment could be livable again, whereas if they sit another 3 or 4 years, we'll be tearing them down. And so just kind of want to echo that, because it is, I went up to Memphis on the last couple months ago, and they are turning over their land bank properties at a clip of about 200 a month, and they are doing that in the county. The county is up in Shelby County, and so trying to find, that's almost like there's some synergy there where we could kill two birds with one stone if we could activate those properties. So I just want to reiterate more investment in making those, because there's a lot of people here that want to buy the properties. We just have a log jam, and so I just want to echo that. So thank you, Madam President.
Thank you, Mr. Woods. I do want to just follow up on the conversation about the land bank and how, I don't know, to incentivize this or to make this work better, but we did have some legislation that assisted with clearing those titles a little quicker, and hopefully we'll see that impact. But I'm like my other counselors, this does give us a good model for the budget and what we'd like to see, because I believe we lowered the amount of money we were giving the land bank in the last budget, correct?
That was correct, because they had a lot of cash already on hand. And just for the council's visibility, they have an executive director and standing up the staff right now, so they have become very efficient and effective, and we're very much supportive of the land bank. The executive director will have a conversation with the administration about how much funding that they will need in the upcoming budget, and we're confident that we have the support to give them what they need in order to clear the titles and get people land and housing. So we're confident about that.
Because I think I can get all my counselors to agree that we just want to see the movement there, and we want to see the process to work for us, because each of us have this land and we have residents that really want to go in and invest and use that as a means. And when we talk about affordability, there are often opportunities there for people who couldn't otherwise afford to buy land and to develop.
And we have tremendous support from Judge Blankenship, who is basically giving us rocket dockets to clear these titles. So with that legislative, like I said, we're very confident that we can move the land bank to where it needs to be.
Thank you very much. So we'll go on to our next set. Thank you. Oh, I'm sorry. I'm so sorry.
No. If this is possible, I did want to request that either Madam President or myself is included in that conversation when you talk to Caroline, just so we can have somebody from the City Council present, even if we just don't really have to say a lot. I just want to make sure we just have that information armed, because I know y'all have a lot of things to do, but we need to get better communication with that.
That is no issue. Thank you.
Perfect. Thank you. Ms. Tate, did you have?
And just to echo what you all have said, in agreement with Councilor Woods about the homelessness situation. I just got a call really today from a guy in California who acquired 4 parcels and through the land bank, and he mentioned that he got a letter stating for him to come back to the city and get his money. So as my colleagues have said, people are very interested, in this land bank. I had a colleague, friend of mine, to travel here from Defuniak Springs over the weekend, that's ready to actually invest and, buy and build. So we got to, make every effort, to do what we need to do to get the ball rolling. I know it's a lot of land in Pratt where the tornado hit, and some presidents have stressed some affordable housing was supposed to be in that area. So I'm in agreement with what everyone here is saying. And also, if we can I haven't really just looked at the timeline of the land bank or something that, you know, like giving people like a time frame or, you know, if I execute an application, when do, and it's good to hear Deputy Mitchell talk about the rocket docket, Chief talk about the the rocket docket, you know, just pushing this effort, you know, forward. Because I'm seeing, you know, in my area, I live right across the street from the Salvation Army Command Center. It's only so much the homeless organizations can do. Because we do realize that our, you know, the brothers and sisters need the wraparound services, and they do need to be in a safe, you know, a safe haven and to feel safe and not put out on the streets just to wait to be back, you know, into the shelters when that time frame. So I think it's something that we really need to be looking at. I did mention yesterday, look at what Houston did. They took an old hotel and converted it, you know, into a, you know, housing for homeless. So it's just models and things that I think that we can do that we don't have to, you know, reimagine. We just can replicate.
Thank you, Councilor. All right, we're going to the next one. I'm sorry.
Yeah, can I just ask one more question of Mr. Mitchell? What is the name of the corporation where that $1 million is going? For the affordable housing.
G.
So the NCRC Growth, which is the National Community Reinvestment Corporation.
And that's,
Coalition.
okay, so that's a different corporation that's building the houses then?
Yes.
So they are building, so they're the same ones that got the grant, so we're paying them to build them, right?
Okay, the answer is NCRC. They're the developer.
No, the city passed a MOU with NCRC Growth for a $25 million commitment about less than a year ago. So it is a separate organization. It is made up of advocates that monitor CRA activity all across the country. So Growth is the development arm of NCRC, of which the most immediate past president, national president, is Bob Dickerson, a local advocate here in the city.
So, again, what's the answer? It's NCRC?
NCRC Growth is the name of the...
NCRC Growth, and that's a different developer than we have already paid to build the houses?
No, sir. I'm not.
I just want to know who's the organization that we'll be working
NCRC Growth
with?
is who we have the
NCRC
MOU
Growth.
with, who we're going to provide the subsidy to, the same organization.
All right. Thank you.
Yes, ma'am.
What?
The next one, transportation.
Yes, so the next item here is a top-line allocation of $7.5 million for transportation. I'll actually take them slightly out of order. The first is the Birmingham Jefferson County Transit Authority and some commitments that the city is making to them or making whole on.
Right. So, Council, if you recall, during the budget process under the current FY22 budget, we allocated $5 million out of the general fund, and that was just to get them from June to December. So this allocation before you will make them whole for the remainder of the fiscal year. And just for information, we are in talks and negotiations with the new executive director, Ms. Charlotte Shaw, the BJCTA, about the allocation for FY23. And it is our hope that the proposal that they submit is more efficient and effective, that we don't have to have more than the $10 million allocation that we have been given to the BJCTA over the last number of years. So that's why we have this allocation, just to make them whole through the end of the fiscal year.
Any questions about the BJCTA portion of this? Because I guess I have one. Just as an organization, they did also receive ARPA funds, correct?
Yes, they did. And for clarification, they had, I believe it was $9 million over 3 years. And if you recall, when we hit the COVID year, where we really had the budget shortfall, they subsidized a lot of their budget using their ARPA funds. It is my understanding that under this infrastructure bill, they'll be receiving a lot of other funds out of the infrastructure bill. So hopefully the proposal will include that money, so we wouldn't have to subsidize so much of our own general fund money for the BJCTA.
Especially when some of those services have been cut to certain neighborhoods.
Reduced. That is correct.
All right. Any questions about that piece? Well, let's go ahead and then look at the VIA expansion.
Yes, so the next item here is an expansion of the city's current VIA pilot, which we've been implementing in partnership with the Community Foundation, Birmingham On Demand. You've probably seen the handful of vans throughout the city. Hopefully you've ridden them. Each ride is $1.50. The idea here, so for those who aren't as familiar, VIA is a microtransit program, so it's basically filling in gaps where our existing bus routes may not be as consistent or as frequent. It's specifically targeted in the sort of core of the city at the moment so that we can get people to kind of core goods and services, grocery store, doctor's appointments, other medical appointments, jobs. It is an extremely successful pilot, and we have a long-term vision for what the kind of deluxe version of a VIA expansion can look like. The ask here is for $1.5 million to start to work toward that vision. And I'm sure my colleague, James Fowler from our Department of Transportation, can speak to it in more detail. But this is really taking a model that we have found to be proven to be successful so far and starting to take the stepwise work of expanding that footprint into other neighborhoods. And long term, the vision is really that VIA and the bus system can work together sort of cohesively such that it's an option that gets people to bus routes, it's an option that fills in the gaps where the bus routes aren't as frequent, and is part of a broader system of microtransit, micromobility, and transit through the bus system that's serving our residents.
Or I don't know if Mr. Fowler was going to.
If you have any questions,
Just any questions, Ms. Abbott.
Yeah, and I just want to know where it's going to be.
Where the expansion is
Yeah,
going.
like, can we see a map of the expansion area?
So,
Mr. Fowler.
I just want to see a map. I don't even care if it's in Bellevue Heights.
Mr. Fowler, thank you.
Again, my name is James Fowler. I serve as the director of the Birmingham's Department of Transportation. And I believe the question was, where would we focus the expansion? I think, honestly, we would need to go back and work on that in coordination with the Transit Authority, so I don't think I could say that tonight. The original proposal, which I think you guys had seen, was developed by a consultant along with the Transit Authority, with a lot of input from city staff as well. But as Amelia mentioned, that's kind of the vision for how it would be expanded. So with this allocation that helps move us towards that vision, we would have to go back and work on what we could fit with that budget.
Okay, so this is just speculative.
And Councilor, with the funding and allowing BDOT to work with VIA and the BJCTA, of course, the funding agreement would have to, because we'll have to amend the current agreement that we have with VIA to include this. So you will see the actual maps of the new routes using the $1.5 million expansion.
Okay.
So this is a starting point, just saying, okay, you allow us 1.5, let us work on what that 1.5 would get you using the current allocation.
Okay, thank you.
Thank you. Any other questions? Dr. O'Quinn.
It's really a comment. So I spoke with Ms. Shaw as early as this morning on this very topic, and she is developing a strategic plan for BJCTA, something which they have not had in the past, a long-range strategic plan. So she is aiming to come to the Transportation Committee specifically to present that after the first of the year. But, you know, a big part of our conversation was with this expansion that we're considering, that it functioned well with the existing transit authority. So, you know, hopefully that can look like something that, you know, serves all of the council districts, but also incorporates the existing fixed route service and paratransit service so that everything, you know, is working as effectively and efficiently as possible together. So look forward to hearing from Ms. Shaw after the first of the year.
Thank you very much. Any other questions? We'll go on to the next section. Thank you.
So the last piece here is related to capacity. I know we've spoken about this in various ways with the council over the last several weeks, but this relates to our ability to go out and get more money. So we're talking about, $70 million that we've been allocating in this first tranche, another 70 coming. There are literally billions of dollars, both in infrastructure bill and proposed Build Back Better agenda, in other just even fiscal year federal grant programs that we are poised to go after, but we need the additional consultative capacity to go out and identify those grants, write those grants, and build the infrastructure around accounting and compliance to be able to take on those additional funds. So you'll see itemized here a line item for competitive grant support, a line item for accounting compliance for those grants, as well as a line item related to equity, impact, and community engagement around those opportunities. We want to ensure that not only are we meeting the baseline of requirements set by federal government for these grants, but we're also meeting a standard within our community and reporting out on the impact of everything that we've been talking about today. And lastly, we understand that some mix of the projects that we're implementing in your districts through other programs, through infrastructure bill, et cetera, will be capital projects in nature. And we're also asking for additional capacity so that our capital projects division can thoroughly scope those projects, manage those projects, and get them done within the time frame of these grants. So this remaining item is really around the additional support that we need to go get it done.
Thank you. Any questions about this portion? All right, thank you. Thank you very much. Yes. Yes, Ms. Clark.
I think it's more for the record. Can you just comment on how these proposed buckets align or relate to all the proposals that were solicited before I got here? Okay.
Yes, so we have run, so initially when this funding came down, we really wanted to hear from our community organizations around their priorities and how they would suggest utilizing the funds. So our team has combed through I think it's now like over 150 submitted projects that came through, scored them, worked with our colleagues within the city to identify them. Indeed, many of the priorities that were submitted, things like VIA expansion, things like investments in affordable housing, things like microloans for small businesses, et cetera, are reflective of the priorities that came through in those proposals. We envision working with council over the course of the next several months, as we know Tranche 2 is coming, to really workshop the additional scope of those projects. So those are absolutely still on the table and still under consideration, and the priorities reflected in those submissions are reflected here as well, but there's certainly opportunity to continue to develop those proposals in concert with the council.
Thank you very much. Councilors, so are we ready to entertain this item to move this forward for council consideration? Do I have anyone to entertain a motion?
So moved.
Second. Any questions? All those in favor say aye.
Aye.
Any opposers? Okay, that item moves for council consideration. Thank you all, and thank you, administration. We appreciate you for bringing this information.
Thank you.
Councilors, we have one last item, and this is the Commercial Development Authority funding. And
Madam President, we'll bring up Mr. Cornell West, the head of our IEO,
Thank
that
you.
will probably give you a brief update so we can.
Thank you.
I know time is well.
I know, we didn't realize it would take us this long, but thank you. It's okay. Mr. Wesley?
Well, it's evening now, so we'll say good evening once again. What your handout you're getting is something you should be familiar with prior to my arrival in my post around the bond refinancing. What you'll see before you are some items that were identified as priorities for funding. I will give a few moments so that everyone has one in their hands.
Okay.
I see Chaz was not assigned to that in school, passing out of documents. So, councilmen and women, Again, this is the byproduct of a refinancing of bond that translated into additional cost savings, or rather capital availability for the city to use, at which point the council pledged to use those funds back into the community. And so again, before us, we have two major projects that you've already allowed to be allowable uses, which namely being Caraway project at $4.1 million, the Ensley redevelopment at 1.5, and what we're asking for today is the reservation for the remaining 7.3 million that is broken out in these appropriate buckets. So again, we have the 4.1 for Caraway as well as the 1.5 for Ensley, which leaves us with the 2 million for Ramsey McCormick, 2 million for Crossplex redevelopment, 2 million for grocery store recruitment, 1 million for sports and entertainment, and finally, $300,000 for the Masonic Temple, specifically the Civil Rights District, 4th Avenue District, and the redevelopment in that area. At this point, if there's any specific questions as it pertains to these items, I would love to answer those for you, but I'm confident that you're familiar with some of these things.
Councilors, I know we do have 3 new members that this is new information for you. You may not know where we were as a council with that before, but do we have any questions or any follow-up? I know this is just a report to us to let us know.
Well,
so an update.
It does require your approval for the remaining 7.3 to be reserved.
Any questions, Councilor Quinn?
Yes. So, what is? Explain to me why you use the terminology "amount outstanding" in the memo.
Yeah. Also, pardon the language used, meaning the amount that has yet to be reserved. Meaning the amount that we require your vote for approval on.
So you're asking us for this 2 million, this 1.5?
That's correct.
Okay.
Would like to drill down with you at some point on the Masonic Temple project.
Absolutely. Absolutely.
But, you know, glad to see that got included on the list for sure.
Any other councilors? Ms. Abbott?
Well, my question about the Masonic Temple is that it talks about the Carver Theater, not the Masonic Temple. So, is this item Masonic Temple, or is it Carver Theater?
Well, as it was presented to you, it was for the 4th Avenue District, and this is my understanding when it originally came before you. And the Carver Theater obviously sits within it, so we were defining what that district was. The project within the district is the Masonic Temple.
Yeah, so maybe kind of explain further, specifically what the $300,000 would be used for.
So it's a small portion of the construction cost. That's literally less than a percentage point of the total development cost. But I will say there's an additional benefit for that investment in that the developer, in partnership with the city, will be able to, at some point, once council approves, be able to even put a vertical structure, additional housing in that downtown corridor on the lot that the city owns. That is yet to come before you, but this is part of a larger development project to truly bring transformation to that area.
Well, you've confused the stew out of me. What are we doing to the Masonic Temple? Anything? I mean,
our $300,000 is going towards the construction costs, or to assist in the development of the redevelopment of the Masonic Temple.
Okay.
And again, that is just that's not even a percentage point of the total estimated around 70+ million worth of redevelopment that will take place in that site.
Okay, so it's privately owned.
It is owned by the Masons.
We have a vacant lot that belongs to the city that we're throwing into the mix?
We're not throwing it into the mix. If that transaction takes place, and again, if that transaction takes place, it would be a ground lease that would allow the developer to bring housing to that downtown area as well.
Okay, that's not the...
But it is separate and apart from this specific ask. That comment was to give you a larger picture of what's all at stake in terms of what this will yield from an economic development standpoint.
Okay. Thank you.
My pleasure.
Thank you. Any other questions, councilors? All right, thank you so much,
Thank
Mr.
you.
Wesley. At this time, can I entertain a motion? All those in favor, questions? All those in favor, please say aye.
Aye.
Any opposers? All right, so this, your abstention, yes, ma'am. Thank you. And so we have one abstention and 8-4. And so this will move for council review. Thank you very much. Again, we are very appreciative to administration and the presenters, and I'm appreciative to the counselors for attending this, our first committee of the whole. And so we will have those on schedule as recurring as we have those posted. So can I get someone to give us an adjournment?
To adjourn.
All those in favor? Aye. We're adjourned. Thank you.